Welcome to the ConcussED Podcast, where we dive into the world of brain health and resilience. I'm Dr. Stephanie Adams, your host to the science, stories, and breakthroughs behind concussions. Whether you're an athlete, a parent, a healthcare professional, or just naturally curious about concussions, you're in the right place. So, let's get started.
In today's conversation, I'm joined by the wonderful Hannah Walton. Hannah is an elite rugby player and a PhD researcher. Her current research, based out of the University of Edinburgh, focuses on injury epidemiology and prevention in community women's rugby union. One aspect of her work, which has gained attention in the press following publication, is on the impact of lowering the tackle height in the community women's game. Welcome, Hannah. We're really happy to have you on today's episode.
Thank you for having me.
So, Hannah, let's take things back right to the beginning. Wondering if you could tell us a little bit about yourself and also how you first got into rugby.
Yeah. So rugby's kind of almost dominated my life since I was young. It's been something that I've played since I was about 9 years old, and it's always been something that's kind of run in the family. I knew my dad used to play, my cousins went down, and kind of throughout school I played every sport that I possibly could. I think it's something that I've actually not taken a break from until ever really. So I've played all the way through and kind of every school club going, anything that I could do. I started out at Southport Rugby Club, so that's my home club and somewhere that I really found a love for the game. Been really encouraged by my family. Played at university when I did my undergrad at Leeds Beckett, and now continue to play here at Edinburgh University in the Buck Super Rugby competition. So yeah, always kind of played rugby and not something I've not known any different one really.
Amazing. I love it. I love when, the fact that there's the family connection, the passion around it there. Do you think that's part of what drove it being one of the sports you really focused on compared? You mentioned you played a number of different sports. What do you think really, got you focused on the rugby in particular and carrying that through to the elite level you're at?
I think the community side of things is just so different compared to other sports. Like, as cliche as it sounds, everyone is just one big family. It's an opportunity to turn up on what might be a freezing cold or snowy day, and you're surrounded by 20 other people who are there to do exactly the same thing as you. I've got my kind of sister involved in it, so she's the captain of our local team now, so that's really exciting. And it's been an opportunity that I've always found people with a common interest, and has allowed me to make friends in every social setting that I've ever been a part of without actually ever really having to try, which has been really, really nice. And I think just having those people around you.
Yeah, the community is so important, isn't it? And someone who works in sort of concussion and wider brain health areas and stuff will know increasingly how good and important that community aspect is for our brain health and our overall just well-being generally. That's brilliant. And I suppose on the research side of things, what motivated you to get into this type of research? How did that happen?
So obviously, as kind of we're all aware, rugby is inherently carrying of injury risk, and is something that I've not actually managed to escape myself very easily. So a couple of ACL reconstructions, a concussion or two, different surgeries along the way, and it's always been something that, even aside from a research perspective, I've kind of thought, well, something needs to be done for player welfare there. Like, there's always something that we can do, whether kind of previously that was as a player or as kind of a friend of people who are playing. I think coaches and referees can really buy into the player welfare side of things. And then I think I was kind of given my first snippet of research doing my undergrad. Obviously, as our last year, we all do a dissertation, and I was in a very hands-on degree. So it's kind of a really unique opportunity to see the research sphere, and then given the opportunity that I did to come to Edinburgh and continue that research journey from a rugby perspective was something that I couldn't say no to really, and kind of jumped at the chance and was really kind of lucky to have the support from kind of my supervisor, Debbie Palmer, to be able to actually pursue this and continue it for coming up to 3 years now.
That's amazing. And as someone who's also been on that PhD journey, doing a project you really love is so key. So I'm so happy to hear that you found that as well. That's awesome.
Yeah, definitely. I think especially within the community sphere, there's such a big kind of research gap, and something needs to build that. It's so much easier to put research into place in the professional game, where there's the resources and the staff and the players that are paid to be there. But we don't necessarily have that in the community game. So if there's something that we can do to boost that player welfare, then I think it's a key.
Absolutely. And with that piece of research, I know one of the aspects you're focusing on, as we said, is focusing on sort of lowering the tackle height and how that's come to fruition, I suppose, is something I'm curious about. So I have a little bit of background context on this, but for our listeners, why did Scottish Rugby decide to lower the tackle height in the first place?
Yeah, so Scottish Rugby decided to lower the tackle height upon recommendations from World Rugby, the kind of global governing body of the game. So in kind of 2022, 2023, there was some there's been a lot of research to suggest that head contacts and higher tackles are actually increasing the risk of things like concussion and head injury. So in 2022, 2023, World Rugby kind of got together and thought about how they could improve that and how they could reduce those concussion rates. And one of the things that they suggested was actually reducing the maximum legal tackle height, where previously it had sat at the line of the shoulder. So quite high, to be fair, considering we've only then got the neck and the head before there's nowhere left to kind of go any higher. So this was something that they kind of thought about for a year or two before they proceeded to kind of get the other unions involved. And what they actually did at the start of the 23-24 season was say to the unions, this is what we would recommend. We would recommend that you lower the maximum legal tackle height. You don't have to do this. It's an opt-in approach. And you can also kind of adapt that law however you see fit for your game. And so with that, Scottish Rugby decided that they would actually take that on board, and it was an initiative that they deemed to be really important. And in keeping with that, they lowered the maximum tackle height across the community game only from the line of the shoulder to the base of the sternum. So kind of a 6-7 inch decrease there. There was different kind of laws that they could implement alongside this, and they decided for this law change and this law variation just to target the primary and the secondary tackler. They didn't have any restrictions on the ball carrier. So down in England, they restricted the ball carrier to not be able to dip into the contact really late to kind of gamify the law. But Scotland deemed that wasn't necessary within the community game up here. And they also said that law wouldn't be applicable at a pick and go situation due to the low risk. So in any kind of open field tackle, the tackler and then the supporting tackler all had to be below the base of the sternum from the beginning of the season.
It's interesting as well that there's sort of that level of ability to take into for the unions to take into the context of their union and what they know may or may not work, and sort of have a little bit of an adaptation there. If we think back to the study itself, there'll be a number of listeners with a research background. Some may not have as much of a research background. So could you explain in simple terms what the study set out to measure and how it did that?
Yeah, so the study itself was actually nestled within a larger study that was funded by World Rugby. And the overarching aim of the wider study, which incorporated 11 nations globally, and is still ongoing in the kind of the broader context, was to understand the impact of the lower tackle height across the whole community game. So this includes men, women, and the youth game. So I myself kind of just focused on the women's game, but we did have researchers here at Edinburgh looking at the men's game, and then what we're working on at the minute in the youth game. So as I say, we as a group in Scotland did look at all of those areas. And I suppose the first aim of the law change was to see if the game changed itself. So did the shape of the game change? And as I suppose coaches and players and referees, that's something that we maybe don't want to see. We don't want to see a drastic change. Some players might. One of the things that we did maybe think was, would we see more offloads? Would we see more kicking? Would the game become a bit more open if tackle technique is tested a little bit more? I suppose specifically in the women's game, where training age and experience are a little bit lower than that of the men's game. The second aim that we had was to understand if head contact decreased as a result of the law change. So particularly within the higher risk areas, obviously anything above that new maximum height, anything for the neck and head is our higher risk areas and has been shown to have increased risk of concussion. So we wanted to see did the amount of head contact across those areas decrease for both the tackler and the ball carrier? And these were both done by video coding. And I have to admit, at times, this was a painstakingly slow process. It did take us a good few months to code all the games. But within this, we coded for, firstly, game metrics to understand aim one. So how many tackles were there? How many rucks were there? How was the ball in play time different? Things like that. And then secondly, we went in and coded each tackle, which was probably the longest part. And each tackle was coded frame by frame to understand exactly what every ball carrier and every tackler did across each of the 34 games I think we coded it in the women's. And then something specific to the women's game in Scotland is we actually had a nice pool of injury and concussion data from one of my other research projects as part of my PhD. And so we did actually combine that, and we were able to see if injury and concussion rates did change as a result of the implemented law variation. So yeah, three kind of key aims here, and Rugby are obviously looking at that in their own way, but from a Scotland perspective, they're the things that we deemed most important in the women's game.
That's brilliant. So a few natural follow-on questions based on what you've just said there. The first one is, in terms of player behavior, implementing this rule, like what were the main things that were observed? Like, how did player behavior change, either the physical, or was there anything in terms of just their mentality around tackling, or like anything that was reported in that space?
Yeah, so I suppose kind of top line statement, and one of the key things that we did find within the research is that players more often were lower into contact. So I suppose the whole idea of reducing the maximum height was to enforce a lower body position for the tackler. And this was, as a result, lowered the initial point of contact on the ball carrier. If a player is going lower into contact, we're avoiding those higher risk areas a little bit more. But kind of avoiding those high risk areas did apply to both the ball carrier and the tackler, I guess, and it's something that we want to avoid for both players. So the main aim, I suppose, was to reduce that shared headspace and reduce the amount of times that tackler and ball carrier head were in the same vicinity. So what we did see was that the lower tackle height showed a significant decrease in the tacklers entering upright, and we, in a concurrent sense, we saw a significant increase in entering the tackle at a bent at waist position. So potentially reducing the amount of a dangerous position that the players would get into for both themselves and the ball carrier. And as a result, we saw making contact at safer areas of the body, which in turn showed an overall significant decrease in a red zone contact. So red zone, anything above the base of the sternum. So really, really positive findings from that perspective, and something that we did see a really positive change in player behaviour.
Yeah. Was there any, I suppose, assessment of what the players thought of the rule change? Like, were they pretty happy with it? Did they find it inconvenient?
Not within this study. It's not something that we had the capacity to be able to kind of assess with players and see whether they actually benefited from the law change from their perspective, whether they kind of disliked the law change. It is something that I think would be personally quite interesting. As a player myself, I didn't really notice much of a difference. Mm-hmm. But I know some players might see it as quite a drastic difference, especially if they are used to kind of tackling higher, or would rather kind of run the ball in a little bit lower. It's making a bit more of an effort for the tackler. Mm-hmm. I think it's something that would be really useful, and particularly as the seasons go on, if that law change kind of alters slightly, or players almost read the game a little bit differently. I think it could be a really interesting piece to be able to understand from I suppose, every stakeholder's perspective.
Yeah, absolutely. In terms of the concussion aspect, did the rule reduce the risk of concussion or other injuries for the players? What did you find so far?
I think if we kind of look at the broader picture and something to kind of really preface the concussion and injury results, one of the main things I would say is that we saw no statistically significant changes in the rates of injuries or concussions between the two seasons. But I think a really important factor to consider with this is across the two seasons, we actually had a really low number of injuries and concussions anyway, which I suppose is a positive across the women's game, is that we didn't have massively high injury rates. But this low number is what we believe we can kind of attribute to our kind of large confidence intervals, and therefore lack of significance in our findings.
Yeah.
But that being said, we do believe our results show some kind of clinical relevance, and there were some changes across kind of the concussion rates, just not statistically significant.
Yeah. Any suspicions as to why maybe that just generally over those seasons that were assessed, there's lower concussion and injury rates? Any just like guesses?
No major guesses from me. Across the 3 seasons of injury and concussion data that I've collected, we don't have massively high rates. I think community injury rates are much lower than professional and elite level anyway. And obviously with us assessing only in the community game, we can only really go on that. And as for kind of these 3 seasons, we don't have any other community women's data in Scotland to be able to compare that to. So this is kind of all we've got at the minute, and just to start. I think we might have some more answers in a few years if we continue to build this bank of knowledge and actually see if concussions rates change with any other law variations that may be implemented, or how the law variations that have already been implemented come into fruition over the next few years. But I think it's difficult in the community game because there's such a large turnover of players that injury rates one season are automatically going to change the next season anyway, because you have such a variety of different players playing.
Yeah. It's interesting you're mentioning there about the sort of the professional gamer seeing more injuries generally and more concussions there compared to the community game. I think that might surprise some folk. Some folk might think, oh, maybe you'd see more in the community game if there's less structures or maybe potential variation in support or training and stuff. Why do you think we're seeing more injuries in sort of the higher level game compared to the community game?
I think if we look at kind of just from a concussion perspective, concussion recognition is so widely spread in the professional game at the minute, implementing different things like instrumented mouth guards and independent match day doctors to kind of keep an eye out for not just those kind of category 1 symptoms, the loss of consciousness, seizures, things like that. There's a bigger eye on actually figuring out what's going on in the professional game, and I suppose if we're going looking for something, we're going to find it. The injury rates in the community game is maybe coming from there's not medical support at every single game or at every training session, and quite often it's a coach assessing to see if a player's fit. I think from a personal perspective in the community game, there's a lot of players that try to play 80 minutes and maybe actually they possibly shouldn't, just because they're there with their friends at the end of the day. I think there's a lot of different factors, and I suppose we might not ever truly know the reason behind that one. And I suppose it will probably vary team to team, area to area, and based on the ethos behind a team and kind of their individual wants as a group.
Yeah, no, definitely. In terms of the next steps with this piece of research, how do you think that this might continue to shape sort of the future of the women's rugby safety or the rules of the game generally?
Yeah, so I think this piece of research, obviously being the first across the women's game, provides a really good base to work from. I think we've uncovered findings that we haven't seen across the men's game, and the same that we haven't seen across the elite game, obviously still the men's. We found some really, really positive things that can be built upon moving forward, specifically kind of with the player behaviour and the decreased amount of high-risk activities. I think for me, it really shows that women-specific research is needed. We are seeing those differences. And in fact, women playing rugby aren't just small men, and kind of I think the narrative to treat us like that is moving on, and that's a really big positive and something that we should continue across other nations. I hope that with this study being nestled within the World Rugby Study, that the other nations that are researching the women's game find similar results, and we can really kind of see how a large cohort of women in undertaking this law change is kind of being shown. I think in terms of the rule changes and rules of the game, next steps will be continuing to understand this rule change across multiple seasons, almost looking at kind of a longitudinal approach and how it alters over the coming seasons, particularly as new law trials are implemented in the future. And for me, it's a case of continuing the analysis and building a bank of knowledge on the game and the changes that are being implemented, and how those players change and adapt to the safety measures that World Rugby are implementing, as at the end of the day, they're all safety measures. And I think if we can get on board as researchers and we can have stakeholders like coaches and referees get on board, then there's no reason why we can't just continue to develop a safer game.
Yeah, so well said. And I'm so interested to see what comes out of the youth analysis as well that the team are working on. Is it top secret, or are you able to comment on sort of what the timeline is on that?
In terms of the timeline, we're not 100% sure. There's a few different factors kind of flying around within that one. We do hope sooner rather than later, but I can assure you it is being worked on as we speak.
That's brilliant. That's so exciting. So thinking more generally in the next 5 years, how do you think or even hope that concussion prevention and other injury prevention work will differ compared to today? I suppose, like, thinking about what would real change look like for you in that space.
Yeah. So I think in terms of kind of change and next steps, there's a lot of next steps that we could take and that we probably should take. For me, I think it all comes down to having some robust injury surveillance data to fall back on. I suppose we kind of get it drilled into us, and I've read so much research that says without injury surveillance and without understanding what's going on, we don't know where to target for injury prevention. I think particularly in the women's game, we're a little bit behind the curve. As I mentioned earlier, we've got 3 years of injury surveillance from multiple clubs across the country, but it's just the start. And I think we need every team buying in and providing data to actually boost this so we can understand what's going on, what injury trends there are, where can we actually action our next elements. And I think to boost this, we should probably put some video coding and video analysis into place with this. Filming fixtures, particularly across the community game, has become kind of a staple part. It's a really accessible tool from a performance perspective at the minute, and so many teams look at it from a video analysis perspective, so the footage is there. I think if we've got the opportunity to look into a detailed injury breakdown with reports and videos to back those up so we can understand specific mechanisms and specificities around the kind of events leading up to injury, we can really understand what elements that we can put into place to reduce injury. For example, it might not necessarily be an inciting event that causes an injury, but a build-up of a combination of events that get to that point. And without us being able to kind of work on this, we'll never know. In terms of kind of next steps that I do know are happening within the Scottish sphere, I know my colleague that I worked with on the Lower Tackle Height project and a fellow PhD student, Hamish Gornall, is actually beginning the onboarding process for nationwide injury surveillance project. So he'll be collecting injury data across the men's, women's and the youth game for the remainder of his PhD, and he's currently inviting people to participate, to upload their injury reports and get some detail on training and match load to understand the overall game. So obviously he'd love more people to be involved with that one, and he's actively recruiting as we speak now. And just a little plug for that one, if anyone is interested, just to contact him at injury.surveillance. He's looking for men's, women's and as I say, girls and boys youth teams.
That's brilliant. Well done on the plug as well. We'll make sure to add that to the show notes as well, because that's a great opportunity that folks should take up if they're eligible. That's really good.
Yeah, definitely.
Yeah. So you mentioned at the start of the conversation, you've unfortunately not been able to get away from some injury yourself. So you have some of that lived experience, but you also have the research hat on. If you could give one piece of advice to any athlete or coach when it comes to managing a concussion or managing other injuries, in fact, what would you give them? One piece of advice?
I think that's a big question, but I think my one piece of advice is to keep up to date with current understanding. I think particularly from concussion, we've already seen huge steps in the professional game with the amount that kind of concussions being taken seriously, and I think the community game can really follow suit. I suppose the most notable example of that would be Gary Ringrose at the weekend with his Lions selection, and possibly the biggest moment in his career being selected to start a Lions test, but notices some concussion symptoms and pulls himself out. I think it's a really admirable thing that he's done, and I think we can learn a lot from that, especially youth players who might think that playing the game at the weekend is the be all and end all. There's always going to be more games, and there's always going to be more training sessions that we can participate in. I think concussion, it's an injury that we can often take for granted, is you don't have a sling on, you don't have a cast or a set of crutches, but the amount of work being done behind the scenes to ensure that the latest guidance for players and coaches and match officials is huge. And I think as a member of rugby, doesn't need to be someone that's actively on the pitch. Understanding the latest guidance is key, and without this we don't know what to look for in ourselves or other people at the end of the day. So I think it's just learning and seeing what's out there. Information is so easily accessible now, just making sure that we keep up to date.
Well said. Yeah, and because it's so accessible now, it should hopefully be that much easier to find that latest guidance. Absolutely. So Hannah, where can people find you and follow your work?
I think the main thing is LinkedIn, I suppose, Facebook for professionals. I put a lot of my updates on my research and any opportunities I have to share my work on there. But if anyone has any kind of specific questions, you're more than welcome to email me. My email is h.walton-4 sms.ed.ac.uk, and more than happy to answer any questions about kind of my work or the research that's been published, or if that's easier, I can direct you to Hamish for the injury surveillance side of things. And any questions are welcome.
Amazing, thank you so much, and we'll also add that to the notes as well for folk to grab. But Hannah, thank you so much for joining us today and telling us a little bit more about the research you're doing. It's so clear that you're incredibly passionate about this. And I just think the fact that you know the world, you know the stakeholders who are part of this piece, so you can, I'm sure you can not only empathize with that, but then also come in and do your job as a scientist, but also, thinking about all the things that come into this is so critical. You're wearing so many different hats there, and it's so wonderful to hear a little bit more, as I said, about what you're doing. So yeah, thank you again for speaking with us today, and wishing you all the best with the rest of the PhD as well.
Thank you very much. On the home straight now.
Thank you for listening. The information provided in today's conversation is for informational purposes only. It is not a substitute for professional medical advice, diagnosis, or treatment. If you believe you may be suffering from something similar discussed in today's episode, please contact your healthcare professional.